This conference will now be recorded.
I'm going to share with you really quickly just a couple of things that our folks, that staff members have told me I need to share. So the first thing I wanted to show you is our website. We are gearing up for an AID virtual run, walk, and roll 5K. This would be normally our color run, but we have gone to a virtual run for this year. So let me show you in events what this looks like. It's going to be over a extended 2-week period that you can run, walk, or roll that 5K, which is 3.1 miles. That you can do that run, walking, or rolling May 10th through May 24th. Our registration link is open through April 20th. So there's some really nice swag that you get when you register for $40. You get the AID t-shirt, and remember, this is our 60th anniversary year, so
Cool.
you get a nice new 60 logo there that you can see. And then you will also receive a medal that also has our 60-year logo on it. Someone who is into the selfie contest, taking a picture of themselves and posting that wall with our hashtag to draw attention to it, will get entered into random drawing prizes to win gift card prizes. We also, if you receive, you can see over here on the right-hand side, if you get $100 or more in donations, you will get this beautiful graphic t-shirt. And I know it looks really busy, but this is actually original artwork that we were able to have designed for AID, and is actually on an art studio in Batavia on Water Street on the outside wall. You can drive by and see it. And so it's, a ship in the middle of lots of ideas and pieces. And so this is original artwork to AID. And so it's pretty cool that you'll be able to get this shirt. The one other thing I wanted to show you is when you come to the AID website, if you go to support AID, you can see that we have a Parent Guardian Advisory Council link underneath that now that has information about this group. It's got our scheduled meetings and what time they start, what the topic is, and who is doing the presentation. And it has the email addresses that somebody could contact in order to get the links to these upcoming meetings. So with that, I am going to stop sharing my screen, if I can remember how. Oh, there it is. I'm going to introduce to you Kathy Carmody, who is the Executive Director of the Institute on Public Policy for People with Disabilities. She is a 30-plus year service experience in serving people with intellectual and developmental disabilities, and has been a fabulous advocate at the Institute as a leader amongst other not-for-profits like AID and others that are members of the Institute, in order to provide advocacy across the state, support for each other, etc. She's incredibly passionate about ensuring that people with intellectual and developmental disabilities know and understand their rights and are afforded those rights. So that's why she's very excited to talk with us today about the home and community-based settings regulation. Kathy, take it away.
Thanks, Lori. Good evening, everyone. So a few familiar faces, and glad to be invited by this group. Just a little bit of kind of background. Probably most importantly, this can be very informal, so you don't have to wait for the end of the slides deck to ask questions if there's anything that's unclear or that you want to kind of have conversation about amongst the group. I have said I'm very comfortable. Put me in front of 500 people, but put me on a Zoom presentation, and I just feel so much stiffer. It really is not the preferred mode of communication for me personally. So I try to sort of bring in some of that, pretend we're in person and people are asking questions and we're conversing back and forth, which is really how I prefer to engage with people. Just briefly, and as Lori said, I've been working in the Illinois system since actually 1985. Prior to that, we had a little conversation. I'm a Michigan native. I worked as a direct support person for the ARC of Washtenaw County, which those of you would know that's in the Ann Arbor area. While I was an undergrad, I moved to Illinois in 1985 to go to graduate school, and worked in the system throughout that phase and have done so continuously really since 1985. I always tell people one of the hats I've worn is, like Lori, a provider exec. I worked for a large provider organization on the executive team for 23 years. So I think that brings I feel like I have a little more informed of a perspective on some issues than if I was just sort of in the strict policy and training and best practice level. Some things sound good sometimes, but when you sort of detangle them and think about how they're really going to work in a provider organization, things can become a little more challenging. So I do bring that perspective to it, and think that probably, as I said, helps to inform some of my thoughts. I'm going to share some slides with us just so it can sort of help me to pace the presentation. And I'll give you a little bit of background. The slides are actually part of a project that the Institute participated on along with the Council on Quality and Leadership, CQL, which is a national accrediting body. And the Illinois Council on Developmental Disabilities issued a grant because they wanted to make sure that people receiving services in Illinois and the families of people receiving services in Illinois understood what some of the changes were that were going to be coming to the system as a result of what we call the settings rule. And I'll talk a little bit about that. So we, through the Institute, did a series of trainings across the state. I've probably been in front of 50 plus audiences of people receiving services, families, and certainly professionals as well, to try to kind of give people a foundation for what the rule is and how it might, how they might see the rule materialize in the service delivery system. So to start, and then I'll go into the slides, I always just sort of try and start with a big picture, and I'll be brief because I presume that many of you have some insight into how services are funded for your family members. But the IDD, Intellectual and Developmental Disabilities Service Delivery System, really nationwide is a Medicaid funded system. So, one of the things I always talk, and I've been, working with parent groups really for decades. It's personally, I think the Illinois system is not intuitive. I don't think it's necessarily logical, sequential, and necessarily easy to understand. So I've always had, a personal interest in trying to help families to really know what they're up against to some degree. Now, you all, I presume, are in the system. You have services, which some of you may have had a challenge in securing those services. Others, your family member may have been in services for a while, but it can be a difficult system to navigate. So I try and help people have some sense of how the system is funded and where it comes from. One thing I always tell people, for example, the system is the same whether you're in Barrington Hills or Anna, Illinois. It's a state funded system. It has nothing to do with property taxes, the value of your home, what you pay for your local government units of service. You have some 708 board money, I believe, in your area, Lori, that does pertain to some additional taxes that you would pay that gets designated for certain behavioral health and IDD services. But the services you're receiving from AID have nothing to do with like I said, what you pay for your local services in your area. So Medicaid, it's a health insurance system. Why does it fund community residential and day services for people? They're about in the early 80s, so I don't even know, does that take us back 40 years? Then the federal government up till that point had not really been participating in the funding of services like each of your family members services. I think someone might need to mute. I'm just going to offer that up. I just suddenly heard some background noise that might interfere. Of course, unmute if you want to throw something out or raise a question. So in the early 80s, what the federal government realized was that the services that they were paying for our people were very costly institutional services. And not everybody needs costly institutional services. So they created a program called the Medicaid waiver. And what the Medicaid waiver does is it waives some of the institutional requirements.
I'm going to interrupt Kathy because I'm trying to figure out if Susan has a question. Susan, do you have a question?
No. I'm just having some trouble with my computer here. I'm just trying to keep muted.
Okay,
We've all been there.
I'm going to mute you, okay?
Oh,
All right, keep on.
Thank you. So what the federal government said was that we're going to allow states to use Medicaid dollars for community-based services in lieu of institutional services. And as you may know, the Medicaid program is funded through a combination of state and federal dollars. Here in Illinois, it's a 50-50 match. So every dollar we spend on Medicaid or Medicaid waiver services, the federal government sends the state back 50 cents on that dollar. That amount varies across the country, with poorer states getting more money back from the federal government. So states like Mississippi, Louisiana, Arkansas, the federal government wants them to use the Medicaid program to provide services. So those states actually get up to about 80% reimbursement. So you can appreciate the deal it is for states. Like, you would want to provide services because the bulk of it is being paid for through federal reimbursement. As I said, Illinois is at 50%. When I sometimes talk about that reimbursement rate, people sometimes think that we're a poor state. And what I say is we've made poor budgetary decisions, right? But Illinois is the 17th highest gross income per states. So we're not at all a poor state. We just have made some, you might say, poor budgetary decisions over the years that leave us cash poor. But the federal government's kind of saying, well, that's your problem, Illinois. I'm not going to give you more money. So just very big picture of how services are funded. The Medicaid budget in Illinois is about 19% of the entire state budget. Okay, so pensions are about 21%. Schools are about 23%. You know, there's not much money left once you get past some of these must-do payments. So, you know, Medicaid is a significant fiscal cost for the state. It has the share of state budget has increased over the past several years, primarily due to the Affordable Care Act, or what's commonly called Obamacare. So more and more working adults have become eligible for the Medicaid program, making it kind of take out a bigger chunk of change from the state's budget. Your family members, I presume, are largely get their health insurance through Medicaid. Some of them may have Medicare as a beneficiary of you. Some of them may have a work history. Some of them may have private insurance. But, you know, even if they have a supplement through Medicare or private insurance, they will have Medicaid as a kind of a baseline health insurance. So that's our Medicaid primer. I always tell people I have done up to a 6-hour national conference pre-session on this very topic. I could talk about Medicaid for days and days. You may not want to listen to it for days and days, but I find it to be an absolutely fascinating topic. So from here, I am going to, Lori, it tells me I'm waiting to view your screen. Do you need to remake me a host again?
Let me look and see.
Because we tested this and it worked earlier. Okay, great. Now I can share a screen. So now this is going to be a 2-step process. First, I'm sharing, And are you guys seeing my screen? I cannot. What do you see? Okay, you see it, but I was able, oh, I have to get into it. Okay, now I can maneuver. Okay, so let me try and get this out of my way because it's kind of bothering me. One more time. Okay, so what we're going to use is just some slides from this training that we've done across the state, going back 5-6 years now. And Lori, I'm going to have you kind of manage if people want to jump in, because right now I can't see any of your faces. I just have my screen in front of me.
Got it.
Okay, so the new rules. So we're going to give you a background, and then when we talk about the setting rules, that's the new rules that are governing waiver funded services. You know, one of the things that the rule really sought to do was distinguish Medicaid waiver services, community services from the more traditional institutional services. And so that's one of the key aims of the goal. So it defines qualities of a home and community-based setting. Your family members who live in a CILA or who attend CDS programs are in what is called a home and community-based setting in Medicaid language. It lists some new conditions that providers, that is AID and others, must meet. So these are things that previously were not requirements or expectations being imposed on organizations. It defines settings that are not community-based. We'll talk about that. And it defines settings that are presumed to have the qualities of an institution. In the Medicaid sort of lexicon, if you're not home and community-based, you're institutional. So think of, for example, some of our, like a hospital as an institution, right? ICFDDs, intermediate care facilities for people with developmental disabilities, are basically nursing homes for people with developmental disabilities. That's considered an institution. And then in Illinois, we have a heavy reliance on state institutions. We have 7 that serve over 1,600 people. By contrast, 14 states have no state institutions, and another 17 states have fewer than 200 people living in their state institutions. So Illinois is kind of disproportionately relies on that. And what Medicaid, the body that governs it, is called CMS, Center for Medicaid and Medicare Services. What they say is there's certain things that they are okay with happening in an institution because it's an institution, but they don't expect to see some of those qualities in home and community-based settings. And that's really what the rule is attempting to define and distinguish for community agencies. So HCBS, Home and Community-Based Services, is the Medicaid waiver funding stream. And it's one option that people can use to support them. And then there's another option, which is institutional settings. And you see on the screen what those are generally called. And one of the sort of ways that I frame this for people is CMS, which again is Centers for Medicaid and Medicare Services. CMS has 2 children. They have Medicaid, state plan services, which are institutions, and then they have home and community-based services. And Medicaid does not cast judgment on one or the other of those. They love both their children equally, but their children are very different, and they recognize that difference, and they don't always see that difference when they look at the actual way that services are being implemented in home and community-based settings. So, see, I'm getting ahead of myself. You already knew the answer to this. Who made the rules? CMS, Centers for Medicare and Medicaid Services. And this is kind of the federal body that oversees the Medicaid program, as well as Medicare. And again, some of you may have direct experience with Medicare as a insurance source as well. You know, and because the federal government is so heavily invested in paying for services, they essentially get to call the shots and make some of the rules. So, you know, if they're paying for services, then they're in a position to tell states, this is what we expect those services to look like. So in this rule, and I should give you a little background, the rule was first promulgated in 2014, which takes us back 6 years now. It was originally supposed to be become fully operational in 5 years, which would have been 2019. It was postponed under the previous presidential administration because states were very concerned about their ability to meet the requirements of the rule. And so the previous administration extended compliance until 2022. And given that the current president was the vice president at the time the rule was promulgated, we would expect that there's strong support in the federal administration for moving forward with the rule being fully implemented. So one of the key things that the rule talks about, and this is some new language in the settings rule, but they use it in different places. So they expect the setting. The setting would be your family member's home, their SILA home, the day program setting they attend is integrated in the greater community and supports full access of people receiving Medicaid HCBS services to the greater community. So, going back to home and community based, Medicaid is CMS, is saying they really expect to see the community in home and community based. And then these are some of the more specific expectations. The rule very heavily supports people working. So it includes opportunities for people to work and they're very clear, competitive integrated settings. So working at any sort of generic employment opportunity that you or I would have access to engage in community life. People should be able to do things in the community that reflect their interests, their values, their culture, control personal resources, and receive services in the community to the same degree as people not receiving HCBS. And this is a standard that the rule sets that had not previously really been in place. They're not saying we want people receiving services from AID to have the same opportunities as people receiving services from Pioneer Center. That's not what they're saying. They're saying we want people receiving services from AID to live lives like the people who live next door to them who don't have disabilities live. And, one of the, I've been in enough meetings with CMS and presentations and conversations. I have heard their response to some of the kind of standard reactions people might have, such as, well, my family member, the person I'm supporting, has a great degree of support needs, and it's really they can't do things as easily as I can, and so it's hard for them to live life the same way I do. And what CMS would say is, yes, right, we understand that. That's why we're paying you money to provide services to that person. That's the intent of the money that we are giving you. That's what you should be doing with that, is assuring that people are able to access what they want in the community. So integrated in the community, what does this mean? Making sure people live in neighborhoods with people without disabilities. I've been to several program locations, AID supports. I don't think this is a concern for any of the residential settings that you operate. There are across the country, and again, this is a national rule, not just focused on Illinois. There are communities, kind of more intentional communities in some states where everybody in the neighborhood is somebody supported by the same agency who has a disability. And that's one of the examples that the rule seeks to say does not reflect the standards that they've now established. And there's a process for what they're going to do about that. There are in some places group home settings on the ground or kind of very proximate to a state institution, for example. And what CMS says is, well, we don't really think that those people are living their lives any differently than the people in the institution, given what that looks like. Make sure people are supported to fully participate in their community. The expectation is people can go to the library, people can go to a, community event, people can take part in civic events in their community, and that's the expectation for the supports that the provider organization is delivering. People are supposed to choose where they live from different options or choices. This is not only challenging here in Illinois, but in across the country. This would be ideal, but the reality of the system in Illinois is that typically a provider organization owns property, and people live in the property, and if they want to live someplace else, agencies will do their best to try and support people, but that might not be the way they can deliver services. So this is one of the challenges that we in other states face. And it's not to say that people are dissatisfied with their living arrangements, but it doesn't start from a position of choice, or historically, I should say, it hasn't started from, we don't sit down and say, well, where would you like to live? And then we'll go support you there. It's typically, we have these options available, choose the one that you like best, but these are the options that you have to choose among. And then the expectations that make sure that people do many different things in the community. That again, there's not an expectation that people with disabilities in a rural area are, living this wonderful life and are doing things 24/7 that are just not realistic for that area. But just that, if people in a rural area typically gather someplace and, I don't know, maybe it's a place of worship on Sundays, or maybe it's a, farmer's market, or that people are supported, that they have the interest to be able to participate as well. So they further talk about full access to the community. The expectation is that people are doing things beyond what we would call an outing or a house trip to a restaurant. The expectation is that they're going to see variety in, that reflects people's individual interests. Activities should be, chosen by people, and this is one that, probably to varying degrees in agencies across Illinois and across the country. I know certainly when I was working direct support, and this is taking us back 4 decades, but, we had an activity schedule. And that's not an unusual term even now, that, people didn't have to do it, but this is what was available for people who wanted to do something on Saturday, or, we had 2 options on Wednesday evening. Which one do you want to do? What they're saying is that it really shouldn't be staff driven, but person driven. And then, emphasizing that same thing. There shouldn't just be a limited set. It shouldn't be, do you want to do bowling or do nothing? Because the person might have interest beyond that. So the supports being provided by the organization and paid for by the Medicaid waiver should enable people to do that. The setting being the home is selected from options that include non-disability specific settings. And I'll scroll through the, oh shoot, now let me see if I can go back. Okay, I can. This is, again, SILA services in Illinois are, SILA group homes are generally occupied by people with disabilities. So they tend to be disability specific settings. Lori, I know your organization provides some more support services and apartments and things like that. And that certainly is consistent with the rule. But, a lot of people in our state live in a setting of 6, 7, or 8 people, all of whom have a disability. So that's going to be a little bit of a challenge. People should have an option for a private unit, and that, again, varies based on the home, the organization, the size of the home. If you have an 8-person SILA setting, 8-person homes are sometimes a little hard to come by. And then the rule enumerates specific rights that the setting should ensure that people experience. And I think we would all, certainly agree to these. And I think these are principles and qualities that organizations, that certainly are involved with the Institute. I can't speak for everybody, but, seek to promote and assure that are reflected in their services, regardless, say, of whether it's a 8-person group home or, a 2-person apartment, such as AID operates. And then again, the setting, this kind of is all connected, right? We're just sort of filling in some of connecting the dots, I guess. But the setting, people should be able to tell staff, hey, I'd like to go for a walk, or, I want to go in my room and be alone, or I've got a friend coming over to visit. The house should belong, the home should be the person's, and the staff are there to support, versus it being kind of dictated to people what their lives are going to look like. So the setting should make sure you have a choice about your services and supports and who provides them. And I think that does exist presently in Illinois. Certainly, you've had people who've left other organizations and come to AID. You may have had people who, for various reasons have left service delivery. So people do have a choice. And what I will say, and Lori knows this to be true, that choice is not as pure, I would say, in our system because kind of transferability and it's a slow process in Illinois. I don't know that that's not the case elsewhere, but someone can't just today say, well, I want to come to AID for services, and they get to have that immediately happen. Or conversely, I decided I want to move to the city of Chicago and get services there. We would try and help people make that happen, but it could take a while. The new rules list some additional conditions that must be met in settings that are owned or controlled by a provider. So that would be if AID indeed owns the property, then there are certain things that have to take place. So CMS would call our SILA's provider owned or controlled. Now that's not universal. There are certainly some people receiving SILA services who have their own lease, some families who control the home where the person lives. So this is not universal, but I sort of guesstimate about 90% of our system of SILA services are the properties are owned or controlled. And that's historically the way the system was designed. There's nothing nefarious about that. That was how the system was designed, was that agencies bought homes and then people moved into the homes. I will say that providers having that equity has been essential at multiple times throughout the system over the past several decades, because they had to draw on lines of credit in order to meet payroll because the state was delayed in making payments. So if you didn't have property that was of value that you could put up as collateral, you would be far worse off than we were at that point. So I kind of always say we shouldn't be surprised at the system we have, because it's the exact system we designed, paid for, and regulated. But now CMS is saying, but it's not the system that we want moving forward. So this is, again, I'll take you to this notion that settings have to be community-based, can't have institutional qualities. And this is, Lori's dealing with this right now because she had to do site surveys for every property that your organization operates, for the purpose of assuring that it really was community-based. I think you probably had to submit like actual pictures, Lori, and Google Map dot points to show that you're not on the grounds of an institution, or you're not, in a industrial setting or something like that. So, so there are 5 specific, and I think there's a little more detail here, and then we'll kind of sort of take down the slide deck. It's an amusing little activity for me, and this is, again, I'm very good at reading cues from my audience. I can't see any of you right now. You could be, toasting each other for all I know. I'll kind of walk through these, and then we can go back to seeing each other's faces. So there has to be a legally enforceable agreement between the person and the organization if they do indeed own the home. The state has indicated they're going to put out kind of a template, not require it, but give us an idea of what they would expect to see in that. And many organizations have a service agreement already in place with an individual or with their guardian for service delivery. But really what CMS is looking for here via the rule is, something much more sort of that mirrors the legal protections that you and I would have, that would not allow somebody to just evict us. Privacy, so, and there's one more screen on this. So this is an interesting one because we're dealing with it right now. So the rule requires that people have a lock to their bedroom, house, or apartment. So if somebody lives in a 4-person group home, then they would have a lock on their bedroom door. They would have a lock to their front door. And as maybe common sense as that sounds, across the system, that's not necessarily the standard. Certainly people who live more independently obviously have keys, and in cases where people have requested, you know, I want to be able to lock my bedroom door, then agencies try to accommodate that. But it being sort of the standard and the floor for everybody is just not the case. So oh wait, let me go back. See if I can go back. So this is just, I digress a little bit, but the state puts out, the way the state communicates with us as the community is through communication called information bulletins. And they just put out an information bulletin on this very topic. Lori would have seen the comments that the Institute replied to. It's just, this is a classic example of bureaucracy at its best. So the state is trying to comply with the federal rules that say you have to do this. The Office of the State Fire Marshal, upon seeing the requirements, said, well, that's very interesting, but you can't do that. And first of all, if you're going to put locks on bedroom doors, then the staff have to have a chain around their neck the entire shift with every key to every bedroom door. And the locks have to be the kind that you can easily just pop with a pin, so that in the case of emergency, then staff can get people out. And you can't use, you know, codes like we all use on our house doors, because that can't be accessed easily. So we brought that to the attention of the department, and they're trying to figure out a viable solution. But it just, like I said, it kind of puts agencies in the middle between, yeah, you have to listen to both. I mean, I have said, I don't think J.B. Pritzker could persuade the Office of State Fire Marshal to change their mind on anything. So,
Hey, Kathy, I mean, the state fire marshal doesn't have the same right to say that about our own personal homes, right? So is it because we are licensed and, you know, have to have the state fire marshal approval that they can do that?
yeah, absolutely. If they're coming in, so if it's an agency controlled, if a person, like if any of the folks who are in the meeting right now, if you say we're in a position where you were able to purchase a condo for your son or daughter, and AID just came in and supported the person and delivered discrete supports, but you know, you or your child controlled the property, then OSFM does not have jurisdiction. But as long as AID is, you know, managing the property, has ownership documents to the property, then we really are, we're subject to them. And there's, like I said, there's just no way around OSFM. I mean, they are a very, and you know, they want to keep people safe. So I'm not trying to say people shouldn't be safe. I think it's going to be interesting to see how this issue gets resolved.
Yeah, and I think part of this really goes back to that whole agency controlled, which is not well defined or smartly designated by the Division of Developmental Disabilities at the moment.
Nope, indeed. We were, I was in a meeting this morning, Lori, where our Rule 115 committee, and Rule 115 for folks governs SILA services, is being rewritten for the first time in 25 years, I think. And we were talking quite a bit about that very topic. So, so we had talked earlier about kind of choice of living arrangements. And again, these are some kind of things that we would want to be taken into consideration when somebody is choosing where they're going to live. And I'm being a little tenuous with it, because again, there's kind of I mean, Lori and I both have the in the weeds, boots on the ground perspective. And, you know, most people in SILA services have multiple roommates, right? I mean, getting a one-person SILA in the state of Illinois is extremely difficult. Not everybody has their own bedroom in SILA services. And that's not to say that people shouldn't, but you know, what began as 4-person SILAs 15 years ago, in many cases have now become 6-person SILAs, because the rates have not kept pace with the cost of providing services. So the only way to account for that is to have more people bringing their rates into the home so that you can continue to deliver services. So again,
Kathy, I will say that that's the, at AID, we have, everybody has their own bedroom at AID.
Very good. That's something you can be proud
a little farther along than some other people have been able to be in that
Yeah.
standard.
Good. And no, I mean, that's something as an organization you should be proud of, and that is distinguishing, because that's not the case universally. So this is an interesting one. When I have done training with families, this highlight of access to food at any times is what gets some people's attention. And you know, I've heard the person who wrote this rule give examples of their expectations, and they do indeed mean this. So, you know, I kind of, this is, I can tell you what would happen in many, many SILA settings across the state of Illinois if somebody who lived there went into the kitchen at 9 o'clock at night and took out a pizza and put it in the freezer, put it into the oven. That in some settings, that's not going to be a problem. I can tell you in many settings, that's a significant problem and that's not permissible. And you know, what the rule is saying is this is the person's home. They should live in their home the same way that you and I live in our homes. And it doesn't mean people are eating caviar and champagne, you know, because people can't afford that. But there should, you know, the expectation is that if somebody's hungry, they can go get a snack. If they don't want to have dinner at 6, they can have it a little later. And that, you know, staff should be flexible enough to make that happen.
Hey, Kathy, I think we have a question about that. Jan?
I do, yes. What if the person is diabetic and they don't understand that they can't just eat candy bars?
Yes. So yes, and that is a very legitimate example. And you know, I don't have hard data on this. I have soft data. That, I mean, the number of people with diabetes that we support is high. There a couple of things, Jan. There are some provisions for modifying these requirements that we're talking about here. These 5 specific ones. And we'll go to that. So it's not that if somebody has like a life-threatening condition that you can't modify the requirement, but CMS outlines a very specific sequential process that agencies have to follow in order to do so. And I can tell you, we had this conversation today because the same holds for the lockable doors. And actually, I mean, I was on in a conversation with our director, Allison Stark, earlier in the week because she was trying to get a little better understanding of this. And so both with lockable doors and with somebody who may be diabetic and doesn't manage their food intake well, typically like that would just be the reason that an agency would impose a restriction. In the case of a key, it might be somebody is, you know, doesn't have the intellectual capacity to understand it. They might eat the key. That's a very legitimate concern that some providers have about people they support. And so those situations, though, what the rule does is define a very prescriptive process that an organization would have to undertake in order to demonstrate that the person couldn't manage this situation and does need to have a restriction imposed upon them. So, and what I'll just tell you is that the process is different than what I think many agencies undertake now with the imposition of a rights restriction. So for example, now, then simply the person having a diabetic condition could be sufficient for limiting access to food. Under the new rule, then there's going to be the expectation that the agency tries to train the person. Maybe the agency gets the person out to a diabetes support group. Maybe they use hospital resources to help the person better understand and learn. So there's a whole, you know, and they have to kind of continually reevaluate whether that restriction remains necessary. So there are provisions for doing so, but I will say that the provisions are more involved than what is generally happening, I would say, in agencies across the state right now. So this is another one, can have visitors at any time. And this is where agencies, you know, really get nervous and can just give off, you know, example after example of situations that, you know, people have other roommates, or people might use poor judgment, or the visitor might be disruptive. You know, typically now, if somebody knocked on an AID SILA at 3 o'clock in the morning, I'm pretty certain that they're not going to be let in. And you know what the rule is saying is that, hey, if Susie invites Tommy over at 3 o'clock in the morning, then she can have visitors at any time. Again, that can be modified, but it has to be demonstrated that there's a reason, and then there has to be kind of a plan for trying to remove or lessen that restriction. You know, this one again, like what I've sort of said to agencies, like I think if you have like a visitor's log in your Scylla home that people sign into, that might not be a good idea. If you have like posted visiting hours, you know, families can come between 10 and 3 or something, that would not kind of align with the intent. And I'll give you the example that Ralph Lawler, who is with Federal CMS, gave on this one. I was in a conference presentation and somebody asked a question, well, you know, what about like if somebody's friend wants to come over at mealtime? You know, we've got 5 people and mealtime is very hectic and, you know, we're trying to make sure everybody's safe. And, you know, his reply just deadpan was, well, when I have friends visit me, we often have meals together. So why wouldn't our people we support want to have meals with their friends? Like it was just like, no, like you're not, he was not willing to sign off on that. He kind of flipped it around and said, I think it's pretty normal for people to want to share meals with their friends. So that would be the expectation. And then the home has to be physically accessible, which again, I think we can all support and agree to. This is the one of the 5 that we've reviewed so far that is not subject to modification, as we've just discussed. Like if somebody needs, if somebody uses a wheelchair, the home has to have adequate, you know, accessibility for the person. You can't say, well, they just won't go in the kitchen. You know, that's not permissible. And then the temporary restrictions. I won't go through kind of the detail, but you can see here these dot points show that these are the expectations that CMS would have. So like the second dot point, going back to the person who may have diabetes, you have to demonstrate that, like I said, you've taken that person to go try and have community education, or you've tried to, you know, encourage them or have a system in place. You know, you've got to show that you've made efforts to help the person become more independent in being able to access food safely. And then again, keep measuring. And by temporary, it means that, you know, it has to be reviewed. I think the rule says every 6 months, to be honest. So again, there can be modifications, but they have to abide by those. And then person-centered planning, I am assuming many of you have had some involvement in the planning process for your family members. This part of the rule, it actually is part of the 2014 rule, but it is in place right now. And essentially when CMS crafted the rule, what they said was, you know, this was already the expectation and the requirement, but what they said was, you know, as long as we've got your attention with this new rule, we're just going to take this opportunity to remind you that, you know, you have to do person-centered planning and how it's done. And then day services, CDS, community day services, some of us still trip and call it DT, developmental training, but the same expectations exist at day program services. You know, the expectation is that people will have choice of what they're doing. You know, they talk about things like, you know, separate staff and person eating areas. The expectation is that people are getting out, that they're not necessarily at a site the entire time, that they can, you know, spend time with people who don't have disabilities. It may be, for example, you have a library group that leaves your day program and 2 or 3 people go and participate in a library class or a, you know, a club at a library. So there's that opportunity. Libraries is kind of the example that I use of, I think if all of our day services look like libraries, then CMS would be happy, because it's a kind of it's a place where you have all kinds of different people come and people can pursue their own interests, and people often engage with each other, and you come in and out, and you know, they're great places. That's just not necessarily the sort of the same qualities that our CDS system has. I'm not speaking to an individual program or, you know, what's going on at AID, but just that. Oh, look at that. Wait, let me see if I can stop sharing now. Am I still sharing, Laura?
Yes, so if you go up by the maybe right-hand side where all the things are, there should be the.
I just paused it. Oh, wait, start sharing my screen? No, it's
We see
paused.
CBS is all about slide.
Well, let me change the presenter back to you. And that way, because that seemed to make me not be able to share before, right? Did that work?
Yep. Can you see us
Yeah, is everybody still awake? Let's see, everybody?
now?
Show sign of life, sign of life.
Everybody was very engaged. They were all paying attention. So.
Good. Yeah, I mean, I would say, you know, this is one of the things I say. I say a lot of things. One of the things that states had to do was submit what's called a state transition plan, an STP, to CMS, saying this is how we plan on making our system comply. Right now, and this goes back to 2014. Right now, Illinois is one of 4 states that still has not had our STP approved. So that doesn't bode very well. And we think CMS is sort of taking a very close look at it. And what I have said is, I mean, Illinois' system, and this is not a reflection, again, on our director, on any provider, it's a system, and it's a historical system. Illinois' system, as you probably know, is not highly regarded nationally. And what I have said is, I feel like when the folks in Washington were sort of looking at a map of the United States and said to themselves, you know, do this radical rewrite of a rule, who might we be, what states might we be wanting to really kind of push along in terms of modifying and changing their system? And you feel like they took a dart and threw it right at Illinois. So, you know, the rule is supposed to impact systems. And if 3 years from now we see no change in Illinois, then I guess the rule doesn't have a lot of teeth. I'm seeing a lot of evidence at the state level of effort to make some shifts and align expectations to meet the requirements outlined in the rule. How quickly we get there and whether the entire system will get there or whether some organizations will move more quickly, whether some have as far to go. Again, Laura, you talked about everybody at AID has their own bedroom. That's great, and that's not the way the system is across the state of Illinois. So again, you know, some people are going to move forward more quickly. You may be seeing some changes at AID in terms of some of the service offerings. You know, some of the things that your family members are being asked if they have an interest in doing. You know, maybe some shifting in day service locations or the way those are delivered once we get back to, you know, normal. So we should be seeing some evidence of some shifting taking place. And I kind of intentionally and did not intend on like taking us to an 8:30 time. I figured if people wanted to, again, have conversation or discussion.
So I was going to say thank you, Kathy, for that presentation, and encourage people to unmute yourself if you have questions that you want to ask Kathy, or any of.
Yeah, Kathy, why don't I begin? You know, this is Jim, and you know, I'm both a parent and a board member at the agency, and you know, my question is, how does this all sound so fabulous in theory and on paper, but when I look and read about the staffing crisis in Illinois and nationwide, and it strikes me that the settings rule is another unfunded mandate that is going to cost the state a boatload of money, but there hasn't been an increase in the federal Medicaid rate matching. for the state. So, take a practical example. Suppose my son in his four-person Scylla, one evening, they all want to go four different places and there's only one staff member. How are agencies supposed to gear up to actually implement what sounds so fabulous?
Yeah, no, Jim, you could be sitting at the table of the Institute board meetings, because those are the very real challenges that we face. So a couple of things. I use the example, and I've used it anytime the state puts something out. We have the opportunity to comment, and the example I use, and I don't mean to offend anybody if nobody. I, Sunday morning is the one I use, okay?
Mhm.
And someone wants to go to the mosque, and someone else wants to go to temple, and somebody else wants to go to church, and somebody else wants to stay home and watch the news. That just we do not have the system that enables that degree of choice. I think our director recognizes that. What CMS would say is, first of all, they would say four people living together is too many. Let me just start there. And, Illinois ranks #1 in the nation in people in out-of-home settings of 6 or more. In some states, including, some of our neighboring states, you can't have more than 3 people living in a residence together. So again, Illinois we're starting from behind the 8 ball. And what they would say is, well, staff should be helping people to meet people, and so a neighbor could drive somebody someplace, or somebody could join a bowling league and they could get picked up. I mean, that would be, and that's that happens in some people's lives, and in other people's lives, making that happen is more challenging. So the other point I would say is, states actually set their reimbursement. The federal government will pretty much match up to whatever amount. There's some exceptions, but so, that's one of the things I do share, is that advocacy for enhanced rates is a state level issue. If the state could double its rates to providers tomorrow, so that providers had resources to actually acquire staff and keep staff and have them do the things that the rule says, and CMS would just have to reimburse at that level. So, and that there is some efforts underway. Lori's well aware of, efforts to fully fund a rate study that was conducted that said Illinois is vastly underfunded. And so where it becomes an issue, Jim, and it's where sort of the rubber hits the road, and it's part of the, I've got about 3 lights flashing on me. I'm gonna probably look like I'm in a time zone or time warp. And we're commenting on Rule 115 right now, which again is the rule, the set of regulations that govern Scylla. And we're doing so, the rule hasn't been rewritten in 20 years. And, during that time, the regulatory bodies that oversee our programs, the Bureau of Accreditation, Licensure, and Certification, or BALC, Bureau of Quality Management, or BQM, and then probably equally important, the Office of Investigator General, OIG. We've had a lot of situations in our system where we've come to find that people have very different understandings and interpretations of things. So in the scenario that you raised, for example, if your son in his 4-person group home, everybody wanted to do something, if a BQM surveyor, which they do as part of their survey, called you as the family and asked you questions, and you said, well, my child doesn't get to do what they want because we don't have enough staff and they can't go where they want to go. That could then come back around to the agency as part of a survey finding. If worse, a family said, I think the agency isn't doing what they're doing and I'm calling the Office of Inspector General. OIG has, very different expectations. And so that's where providers really get kind of put in that impossible place, because, if we all agree on what, enough is enough once a week, is enough twice a week, does it mean whenever the person wants? If that's an expectation, that expectation is not going to be met. It's not going to be met in our system, and it's not going to be met in many systems. What I find is that, and our Office of Inspector General has changed recently, and I find the new person to be very more, I guess, realistic, I would say. But that's a situation that agencies face is, you're saying that you want us to do these things, we're not funded to do these things, and even if we have the funds, we can't find the staff to do these things.
Yeah.
And the example that Kathy gave about OIG, who expects us to keep everyone perfectly safe in all situations. So let's say those 4 young men wanted to go 4 different places and they went with family member, a friend, a peer. If something happened to them during the time that they were gone and they weren't in our care and we didn't keep them safe, we would have an OIG investigation, on our hands. So it in fact inhibits the ability to give some autonomy and some choice, right, to clients about where they go and what they do, because then we'll ultimately be held responsible and could actually end up, in the very worst case scenario, having to close down because we have, something horrible has happened, an accident, that no one intentionally harmed anyone, but let's say, God forbid, someone gets in a car accident or is, hit by a car when we are supposed to be ensuring their safety. I don't think, we'd get sued and we'd probably lose. Then that would probably be the end of AID. I mean, I'm not trying to be like fatalistic or scary or anything, but we take lots of risk within the system all the time in order to try to support people in the ways that are they want and that will hopefully, continue to move towards complying with this regulation.
One of the things too, Jim, just in response to that I should say is that the settings rule, Illinois has 9 different waivers. We have the adult DD waiver, we have an elder care waiver, we have a traumatic brain injury waiver, we have a physical disability waiver. The settings rule applies to any waiver program. I think probably many of us could look at some of the other populations and say, well, sure, just because somebody has a physical disability, they shouldn't not have choice to do what they need to do. I think of, my mother. If my mother gets homemaker services, discrete services or visiting nurse services, there's no expectation that that homemaker is accountable for something other than delivering homemaker services, right? And if then my mother or any elder person were to do something that, caused harm, it's not on the homemaker because that was not the expectation for what they did. But so it's interesting with our population because they do need a different level of support. So to apply the same settings rule, but not to have some kind of acknowledgement, but, and some of your children may be perfectly capable of maintaining their safety and well-being without staff support. I don't know your family members, but a lot of people in our system would not, and, do need that level of oversight that agencies provide. And it's just very different from, somebody with a TBI, somebody who was functional adult, led a productive life, had a traumatic injury, and now needs some level of support. That's going to be a different scenario than somebody who, has a disability that they've had since birth and has always needed a fair degree of support.
Other questions? Discussions, talking points, interests, recipes, songs, I'm a musical theater person. Anybody want to do a quick performance before I think theater?
Since we're talking about housing, I'm thinking of Rent, but go ahead, Lori.
If you don't want me to, don't give me the opportunity. Mary Beth, did you want to say something?
Hi, I would love to be able to get the word out to more parents about this group. I found out about it just by chance from a mom that I met at church named Susan, but otherwise I wouldn't have known. Is there maybe an email blast that can go out to everybody?
So we have been sending email blasts out to the people that we have on our list. So if there are other email addresses you think that we should send that to, please, you can send that to me or to Jim. We also have on our website, I showed it earlier, if you go into the, I think it was other services setting, then there's a link to Parent Guardian Advisory Council, and then it has the list of all the meetings and what dates and times and what subjects, and then it has the email links for myself or Jim or for our information email, and if anybody sends us an email, we'll send them the link to the upcoming meetings. If you have ideas of places that we need to send it to, please let me know, and we will definitely do that. We've been trying to figure out good places to send it to.
I have a
Thank you.
question.
I have a question for Kathy. We've talked a lot about the, maybe shortcomings that Illinois has. Are there particular states out there that are good role models?
Yeah, it's interesting. I mean, there are states that do some things well. And I can give a few examples. The first answer I'm going to give you is I have yet, and I do a fair amount of traveling. I have yet to go to a state where a family says to me, "We have the best damn system I've ever seen." I've never seen. And I know, Carol, you're in Michigan. Michigan is actually a state that has closed all of its institutions. It has different now, and it's a little bit regional. So some parts of the state operate differently than others. But there's, smaller settings. Michigan, for example, has public education through age 26. Illinois stops the day before your 22nd birthday. Wisconsin is generally seen, we sort of in the disability industry all kind of think of Wisconsin as nirvana. And again, my colleagues in Wisconsin don't see it that way. But there's like Wisconsin, for example, no out-of-home settings are more than 3 people. So, that's kind of, that's a measure that we use to say, well, that's a more progressive system. California, for example, supposedly has no waiting list, although, again, my friends in California will tell you, yeah, you might get some services. You're not necessarily going to get everything that you need. New York has very well-funded services, but as you can imagine, a state that size, there's a lot of issues in New York. Oversight is concerning and not as good. A fair amount of abuse and neglect complaints. I don't know, Lori, I mean, I know like Iowa and Kansas, we don't want anything to do with them. They're managed care states for their IDD services, and my colleagues there just said, they've come here. They're like my cautionary tale. We did a forum a few years ago and came and talked about how the managed care system is not working well for our kind of service delivery. So, it's more of a picking and choosing, I would say, Mary Beth, that there's some things, again, Iowa or Indiana, for example, has no institutions. They have, some integrated services, but what people tell you is there's a cap. So, you can't necessarily get all the services your family member needs because you're limited in the amount that the state's going to give you to acquire those services. So
employment services are pretty good, right? Tennessee has a waiver.
Tennessee does. Yeah, Tennessee is CMS's poster child. They love Tennessee. And Tennessee is operating under several court orders. So yeah. But Tennessee does have some services that really emphasize employment, and those are kind of other states look to Tennessee to see how they could try and expand employment for their population.
What was your question?
Tony, did you have a question?
Oh yeah, I was going to ask, obviously with COVID, it was kind of hard for everyone to leave their homes and go to like grocery stores and obviously drive-throughs, restaurants, things like that. Do you have an idea when it's gonna start opening up somewhat of everybody going out?
So I will tell you this, for our population, I mean, our folks who living in group homes, living in solo settings, I mean, I think we've probably got a 98% vaccination rate right now. I mean, the state did a good job. It took, you know, it didn't happen overnight, but so our Scylla group homes are vaccinated. The other, you know, for CDS families is opening up. We have an issue with staff. I mean, as you probably know, there's a lot of reluctance among our direct support pool. Some agencies, I was with an organization today, they are not going to let staff return to CDS settings unless they're vaccinated. They've made that decision because it's just too much risk. And I will say, I mean, some agencies have, as Lori said, you know, earlier that you know, some CDS services have resumed. I mean, among our agencies, kind of statewide, and there's some regionality to it. You know, we have some agencies in the St. Louis area where it's even worse than it is up here. But, you know, people have started to, what people are telling me is that there's been some resumption of, you know, cautious and being safe, but people getting back out, particularly, you know, people are grateful for the warmer weather. They can do family visits outside if that was something that had been limited. You know, again, the CDS resumption, part of that trick is the transportation, and if agencies are willing to kind of have people get on a vehicle now to be transported. But it does feel like agencies are reporting that it's, you know, they're inching their way back. And I guess I would say, I mean, I know we've dealt, Laura, you weren't able to be at our meeting earlier in the week, but the pharmacy that is been really instrumental in helping a lot of IDD organizations, was talking to them, and they actually talked to our group. You know, one of the concerns right now, and this is, you know, this isn't insider baseball, this is as much as I know about it, but they haven't yet developed the booster for the variant. And, you know, what our pharmacy is saying is that pretty much everyone's going to need the variant booster. So I think that might still kind of stall, particularly our folks with compromised health conditions and things like that. And I was asking today if like, you know, when is it underway? I assume it's under development, but I don't know. The pharmacy did not yet know. And again, this pharmacy has administered tens of thousands of vaccinations to our population.
Kathy, can you back up for me? You went a little fast and I didn't totally understand. Did I hear you say that staff cannot return back to work unless they get vaccinated through
No, well, in one organization, they have made the decision that, and so there's a difference between telling staff you have to get vaccinated and you can't return to the site unless you're vaccinated. And they're choosing the latter. That's just their stance, is that, you know, with the CDS location where everybody lives in different homes, or, you know, some might live in group homes, but you've got so much kind of coming and going and inability to really control for things, that about the only thing you can control for is show me your vaccination passport. You know, you have to demonstrate that the person's been vaccinated. And so just one agency had indicated that was kind of the position they were taking with their staff, was you need to, in order to return to the setting, you need to have gotten vaccinated.
And that is not the stance that we have taken at AID, because most of the HR lawyers that we have spoken to have said that we can't do that, right? But we have taken the stance of strongly encouraging and making opportunities available to people, and we are in the process now of trying to kind of determine, you know, this is protected health information of a staff member, and we have started giving rewards or an award for having taken your shot, you show us a copy, send us a copy of your completed card with both your dates on it, as long as it's not the one Johnson & Johnson where you only need one shot and you would only need that. Then you get a t-shirt that says vaccinated and dedicated AID on it, and you also get a $10 Potbelly gift card. So we're trying to gauge how many staff members have availed themselves of the opportunities that we've provided. And we have had very, very many of our clients that are vaccinated and are hoping to do another first dose vaccination clinic in mid-April to catch any laggards or new staff or people that have changed their mind or folks that haven't been able to get those at this time. I want to take a second. Susan, you're unmuted. Did you have any question that you wanted to ask?
I did have a couple of questions. I'll try to make them brief. The first one is I'm given the timeline and all, I'm wondering if at this point you can tell us what steps AID is taking towards compliance. And I guess I'm also wondering, as a parent, I understand that I can advocate. I understand I can sign witness slips and different things like that. I'm wondering on a very functional level, what, if anything, can we as parents do also to move the compliance along? How is there a way we can help with any changes in programming or volunteering or anything like that that would, assist AID in being able to move more towards the compliance of the settings rule?
Yeah, that's a good question. So I think that much like many other providers, we are a little bit waiting on the state's guidance and plan and what they're going to look at and expect. So we could go out and make a bunch of keys, and if the fire marshal decides they have to be a different type of lock, we would have spent a bunch of money wastefully, right? That wouldn't get us in compliance and wouldn't keep people safe. So I do feel like we are probably a little bit further along the path than some organizations, because again, we do have individual bedrooms. We have a lot of clients that live in settings that are apartments or parent directed and owned homes, etc. So I think we have some spaces. We're also looking for guidance from the state in terms of, like, for your community day settings. We are able to do only what we are paid to do at this point, and it's not to do all the things that we're going to have to do, right, in order to comply with this regulation. So, we're kind of, we're looking at things, planning, we've put stuff into place. We have changed, over the years. We have reduced, our community day settings used to have upwards of 300 people, with disabilities, all working at what, people would consider sheltered workshops. And that has been, we've been working for years on reducing that number, getting people into the community, having small community integrated programs like our STARS programs that are at different sites, working with special recreation districts, etc. I feel like, some of the things that we can do, we have done. Other things we are in process of looking at how we can do. And the third thing that we're doing is waiting for some help from the state as to what they're going to specifically look for in order to say that we're in compliance. Because as Kathy said, everybody has their own spin on the words that are out there. So words don't just mean one thing, right? So the word key can be multiple things, right? It can be a fob, you can do a touchpad, you can have a physical key, you can have biometrics where you put in a finger, you can have a card that you have to put in. So it's waiting for some of those more specifics so that we ensure that we are the best stewards of the funds that we do have to ensure that we can comply with this, as well as working on things ourselves. Does that make sense?
Lori, one thing that I would add to that, and I can send you, if you're interested, Lori, maybe to get it out to this group and others who advocate on behalf of AID. But one of the big pushes that we as the community system have during this legislative session is the state was forced to and did an independent rate study over a 2-year period that concluded that indeed Illinois needed to pay more rates. So we're trying to use that as our foundation for legislative advocacy this session. And so the Institute did a fact sheet. The body that did the study was called Guidehouse. And we did a Guidehouse rate study FAQ. If every parent connected to AID sent it en masse to your legislators and said, we support the legislation to fully fund the Guidehouse rate study, that would be a great piece of advocacy, and it would be a quick email with an attachment to it. But if you told your friends and they told their friends, your legislators would be wondering like why people are blowing up their inboxes. So that's just another quick thing that people could do. I'll send you that FAQ, Lori, because it's a really, we want to make sure the General Assembly understands what the rate study is and why we are advocating for full funding of it.
And that fits so well with one of the pillars that this parent group is based on, which is advocacy. And since we're just getting going this year, our first advocacy training is going to be in the month of May. So, I hope you'll all be back for that and, spread the word. But that I think is really, really important.
Yeah, and I would say that we do send out, if you don't get our email blast when there is an advocacy action to take, you can sign up on our website. When you log in to aidcares.org, it'll pop up and say, do you want to get, our newsletters and email informationals? And we send those out. We try to keep it, we don't want to have 1,000 emails in your email box, but send out when things are very important. And I know people probably don't think that I do much work, but I do have a lot of meetings coming up with a lot of our legislators around this issue, because we are pushing on that. And we also have been working on the federal level with talking to our federal legislators about reducing and getting rid of institutional bias. So those are kind of our two biggest things that we're pushing for this year. Mary, did you have a question?
I did. I have to say, just these 2 meetings have been so enlightening. You have made mention of a number of different housing options that AID is offering, and hearing that you have them just living with 2 roommates together is like, wow, yay. And Bob and I have made a goal that we want to get a better handle on what's available for us to choose for our daughter, who's 30 right now. In the next few years, hopefully we'll get her to say she's ready. Right now, when she hears us talking about this, she says, I'm not ready. But anyway, I see we have a housing segment in August. If we wanted to start gathering information, I know coming out of the pandemic and everything, it's been kind of odd, but where would we start? Do we start with? We do have a case manager, but we've always told her that Maria wasn't quite ready yet. And usually in May, June is when we do our plan. Does that need to be more into that?
I mean, Kathy can give you her thoughts, but personally, I would start addressing that in your person-centered plan. Like, what is your plan moving forward? And it doesn't have to be that tomorrow, right? That she is moving out, but that you're going to begin to explore, the options. That the goal will be towards her moving and living in the community, exploring what type of setting you're interested in, what roommate, if any, that you're interested in, etc. Kathy, is that probably?
Yeah, and this is just a sort of a little practical, what I would encourage. I assume that your child is receiving some services from AID right now, though not residential. And, I mean, does she have a friend who does live in a SILA setting? Can she start, remember talking about visitors and coming at mealtime? Can she start going to visit her friend at the SILA setting to get a sense of what that looks like? If she doesn't know somebody, I'm sure if she's in day services, somebody there could say, hey, your daughter's Maria and Sarah, you guys have some common interests. Let's all have lunch together and try and start build some of those bonds. And, that's just my very practical suggestion is if she could start spending some time with people who live in a SILA setting and see what it is, she might, change her mind in a hot minute. So
How about if you have someone in mind, but they live in another county? Is AID only for Kane County?
No, we do DD services in Kane and Northern Kendall County. At this point, we've also been asked to think about DeKalb and McHenry, so we're trying to decide how we decide on that, because we just talked about having a staffing crisis and being able to offer some services in some other counties where we do offer behavioral health services. Might make sense, but in particular, if the person has services, they could potentially come, to AID for services, and they could move in Kane or Northern Kendall where we already, do services, and it might be able to work out. But this is a really long conversation, and I don't think you guys want to continue much past 8:30 right now. So I'm gonna say thank you to Kathy very much for sharing your expertise and knowledge with us.
gladly.
Yes.
And I thank all the parents and guardians that participated today. Do please let us know if there are other people for us to reach out to. We'll put this recording on the website in that location that I showed you earlier. It's under
Support.
Yeah. Thank you. You're right. Support AID is what it's under. Thank you. So the recording will be underneath there as well. If you know anybody that would like to watch this, the list of ongoing meetings is listed on there. And if you have people that you want us to send this information to, or other email addresses, talk to your peers and other parents and families, and invite them to come, because I think we're going to continue to learn a lot together, figure out better ways to support each other and ways to, enhance and move AID forward, so that we are meeting these goals and doing all the things in supporting your family members and their life in the community.
So our next meeting, everybody, is Thursday, April 22nd, and that is going to be the first of the 4 annual advisory meetings that Lori is going to host. So maybe it'll be a follow-up on some of the conversations we began here tonight. Hey, again, everybody, thank you for your interest and commitment to the organization, and we'll look forward to seeing you next month.
Thank you.
Thank you.
Everybody.